Great. Well, I think we should make a start because our time is so precious and we are so privileged to be joined by Maureen this afternoon. For me, where I'm not sure what time of day it is for you in your country, but it's such a privilege to welcome Maureen. Maureen was previously the president of the Institute of Health Improvement and has led initiatives that have turned into global movements. And that's not an exaggeration. So we're so lucky to have Maureen here with us as part of our Leadership Insights series. And as you know, if you have joined us for more of these sessions, what we're hoping to do is introduce you to just the start of some of the key ideas that will help you to think about how you can lead from where you are. How can you influence change as a student or early career nurse, or if you're more senior and experienced in your career, how you can start to open up opportunities for those that are fresh into the profession to bring their ideas and insights. And we will only scratch the surface today, I'm sure, but we will gain some wonderful nuggets, I think, from Maureen that will help us think about what our next stages might be. And just to say, we're using these sessions as an indicator to us of what you want as a community. So if what you've heard today from Maureen is really helpful, it gets you excited, you want to learn more, then please do let us know through the evaluation forms and we will make sure that we develop our programme to offer more opportunity to dig into these topics in more detail. So that is everything from me. I'm not going to take up any more time. I'll hand you over to wonderful Maureen to take us through her leadership insights on the topic of leading from where you are.
Great. Thank you so much, Emma. It's a delight to be with you all today. And I want to just start by saying I do have some slides and some of my own history to share, but I would love for this to be a conversation. So you can add things to the chat, questions to the chat, or comments, or you can stick up your hand, or you can just take yourself off mute at any point, and let's try and make this as much of a conversation as we can. So I thought I would start, and I do think the topic of how you can create change from where you are is such a critical one. And so I thought I would share a little bit of my own history to give you a sense of how I got to be such a firm believer in that concept. The first example I wanted to share with you is a lesson from my mother. So I'm the oldest of nine kids, a big Irish family. And this was my mother's birthday, and my mother was like the most amazing mother. She was incredible. And when not too long after this picture that I took this picture, my mother had a stroke, and she was brought to the hospital locally and was in the intensive care unit. And a couple things happened there that really changed my career. One is that we had a kind of a family meeting, and you can imagine how big it was with all my brothers and sisters. But her primary care doctor and the nurse in the ICU came and sat down with us, and they said, "Tell me about your mother." And I said, I'm the oldest. So I said, oh, she's 78 years old. She's had bilateral knee replacement. She's diabetic. And the doctor put up his hands and he said, no, 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 no. Tell me about your mother. And that opened my mind. I mean, here I was, the nurse, the only medical person, and I'm talking about her clinically. I have one brother who's kind of the trouble brother, and he said, I'll tell you about my mother. She always loved me best. She told me every day she would call me and tell me she loved me best. And we all started laughing. And for an hour, we laughed and cried and told stories about my mother. And they were with us, the doctor and the nurse, the whole time. At the end of the hour, the ICU doctor walked in and he stood over us, the big group, and he said, your mother is intubated and she's going to need a trach. She's never going to be able to eat again. She's going to need a feeding tube. I don't know where you're ever going to find a nursing home that will take care of her like this. And then he just looked at his watch and he said, I need to get back to work. And my brother, the trouble, said, well, because my mother's dying. She's not your work anymore. And that whole interaction really taught me to move away from what was clinical to who is this person and what really matters to her and the family. Um, it was an incredible experience. And then the CEO of the hospital, who was a friend of mine, came up and he said, "Is there anything I can do for your mother?" And I said, "No." And he said, "Is there anything I can do for you?" And I said, "Oh, yes." I said, "Take away visiting hours." I said, "My mother's dying. We need to be with my mother." And he said, "We don't have visiting hours." And you lock me away from my mother every day. And he said, "We don't do that." And I took his hand and I said, "Let's go up to the ICU door." And he stood there and I said, "It's locked. The nurses put paper over the window so you can't see in, big stop signs, and there's a telephone that you have to call into the ICU and ask for permission to see your relative." And I said, because I'm a quality nerd, I kept a little run chart on how many times my first call I was allowed to go in, and it was like 10% of the time they would say, "Okay, come right in." Mostly it was the doctors making rounds, we're bathing her, it's always, and 1 week later, the CEO called me and we went up to the door, and this is what it looked like. And I learned that speaking up matters, but it matters how you do it. First of all, taking him there, and standing with him in front of the door and saying, "This is what I see every day when I'm coming to see my mother." He had never seen it before. As a matter of fact, doctors and nurses who worked in that unit or worked on that floor said, "I walked by it every day and I never saw it that way." So our job in making change is to help people see in a different way. It's really describing physically the impact on patients and families. It's taking people there and showing them what it looks like. And that really made all the difference. I'm telling you, that whole unit is, I brought him, he asked me, which I thought was pretty gutsy, to join the patient and family advisory group. And the first meeting I went to, we were in this big boardroom with fancy tables and a big dinner. And we sat there and listened to the people at the hospital talk, all the patient and family advisors. And then at the end of the meeting, the CEO said, "And next month," and I said, "Oh, I'm not coming back next month." I said, "The only way I'll come back for the family advisory committee is if we have the meeting in the waiting room outside this ICU." And he said, "What are you talking about?" And I said, "We're in this fancy room talking about patient care." This patient, the family waiting room had a few mismatched chairs, no access to food or water. We went and had the meeting there, and then the next month, the whole waiting area had changed. So it's really, I think, bringing people to the place and helping them to see, that makes all the difference. Now, I started my career as a nurse. This is my nursing picture, which my nieces and nephews all laugh at. They say, "What's that thing on your head?" That's my nursing cap. Um, but I started my career as a nurse, and after a few years, I was asked on the right-hand side to be the CEO of a hospital. I was 34 and a nurse and a woman, which was highly unusual at that time. So, how did I go from ICU nurse to hospital CEO? I think all of it was about learning to make the changes through the lens and the power that you have. I After I was a CEO, I went to work with Dr. Joseph Duran, who was one of the world's leaders in quality improvement. And he taught me everything about the improvement model. He taught me how to measure quality as it currently is, and then how to take a look at, does this need a brand new model of care, quality planning? Does it need just more measurement, or does it need total change in quality improvement? Those tools, incredibly helpful to help me to take a look at things that were not working, whether it was infections or waiting times or anything, and make the changes that I needed by using the quality improvement method. Um, One of the things that was really powerful for me was a small group of us, executives got together and we said, is quality good in healthcare? And at that time, we didn't know. We didn't share data across healthcare systems. We didn't all measure it the same way. So each of us took a different industry outside healthcare and we went down and spent a few days with them. And I got Florida Power and Light. It was an electric company that had won world quality prizes. And I went and spent a few days with the electricians, and they taught me everything about improving quality. I never would be where I am today without the electricians. The first thing they said to me was, "What's your biggest quality problem?" And I said, "I don't know. I really don't have a lot of data. The only data I had was financial." So I pulled out my financials, and the biggest gap I had was agency nursing, temporary help. And they said, "Why are you using temporary help?" And I said, "Because I don't have enough regular staff." And he said, "Why not?" And I said, "Well, they're leaving and it's hard to recruit." So they totally changed with me running quality improvement cycles, how I recruited, how I retained. I recruited nurses, I kept them. It totally changed nursing satisfaction, quality of care, nursing patient interactions, nursing physician relationships. The electricians taught me my first improvement work, and it was about how to improve nursing staffing. And it made all the difference in the world. So Don Berwick and I then got together and started thinking, is there more we can do to spread this? And we started the Institute for Healthcare Improvement, IHI, some 34 years ago, I guess now. So my challenges to you is to think about how could we make care safer? I think it's really nurses have that unique vision to see what impact unsafe care has. We see what the long-term hospital stays or the pain of complications are. And we have, I think, a unique way to look for better outcomes. We also have a different way to think about patient-centered co-design. And this is where I've been leading some uh, global movements on co-design that I'll share with you and invite you to. But nurses, I think, have the greatest way to see where we can partner with patients and families and each other for better designs. I think we need to all work on a safe, respectful, and joyful workplace, lower costs, and healthier populations. And so I think we've got some lessons that I could share with you. We need new leadership skills, and that's why we're all joining this group led by Gemma and all to think about how we bring these new leadership skills in. How do we collaborate across professions? And we need to innovate and create new designs. Let me stop for a minute and see if anybody's got any questions or comments that they want to add at this point. As I said, I welcome your ideas and your questions as we go along. Okay, well, do jump in as we go, okay? Um, Another, I think, really powerful lesson for nurses is that we, again, see things in a different way. A few years ago, I was doing a leadership plenary talk out in California to several thousand people, leaders in hospitals, and they said, would I come out to California and do the plenary talk? And I said, I will, but only if I get to begin my plenary by interviewing two patients up on the stage. And so the first woman I interviewed was a woman who had breast cancer. She and I still talk all the time, many years later, but she was telling me that the challenges that she faced were not so much the clinical impact of the diagnosis and the treatment, but getting to the chemotherapy. And she said every day she would have to go out, wait at a bus stop and take a bus for an hour and a half to get to the chemo and then back again. And she said I said to any of the people in the audience here who take care of you, do they know about this? And she said no. She kept trying to tell people how challenging it was to get to chemo. And then finally, she said, sitting in the waiting room, she was talking to all the other patients who were having the same problem. And she said, you know what? I will hire a bus for us. She called it the chemo bus. And so all the patients hired a bus to take them back and forth to chemo. And on the way, they played musical instruments, they told jokes. That sense of connection, of we're not alone, of we're in this together, made a huge difference in their care satisfaction and even in their clinical outcomes. But it was just getting her up on the stage and saying, tell me about you. And then I got Gilbert up on the stage, and Gilbert was sitting up there in his wheelchair. And I said, Gilbert, tell me about you. And he was telling me about how he, what his work was and going to school and all. And then I said, tell me about your wheelchair. Now, I'd been in healthcare for a long time. And he said, oh, it's great. It's only weighs 30 pounds. I can fold it up. He can drive his car. He gets it in the back seat of his car. I said, does anything ever go wrong? And he said, oh, when I get a flat tire. And I said, oh, I've never thought about a wheelchair getting a flat tire. And I said, what happens? And he said, I call my doctor's office and I speak to the receptionist and I tell her I have a flat tire. She makes a note. And when a nurse comes out from taking care of patients, she gives the nurse the note. Then the nurse will write a prescription for a replacement tire. And then the doctor signs off on it. And then when they get it all, they will send it off to Central Sterile and then they will send for the wheel. And then when the tire comes back, they'll call me to come in and get the tire replaced. And I said, well, how long does that take? And he said, usually, a week. And for a week, he can't go out anywhere, do anything. And I said, did you ever try? And a nurse jumps up in the audience and she said, I got a flat tire on the way home from work last night. I called roadside assistance, and 1 hour later, I was driving away. And so the whole group started talking about why can't we do roadside assistance for Gilbert? Why do we make him sit for a week without his wheelchair? And it started to provoke a whole lot of conversation. I said to him, anything else, that you want to tell me? And he said, well, I said, he said, well, when I go into the men's room to empty my catheter in the sink, he said, all the other guys used to get crazy because they were like, don't you put urine in our sink and all that. So I said, did you talk to your doctor about it? He said, the doctor said, yeah, there is something else you can do. You can put it in the microwave. Well, that drove all the guys crazy. So here he is I asked him, how often do you get urinary tract infections? He said, so often that there's a shelf in the pharmacy called Gilbert Cipro. And so all of a sudden, the people in the audience are starting to say, we can fix this. We can fix this. We can change the way that Gilbert's care is happening at home and in the hospital. And pretty soon, Gilbert said that the reason that he had to keep using the catheters over and over again is because our Medicare population only is allowed so many catheters a month. And the nurses and the doctors, when they saw this, said the talk, Gilbert, come, we're going to change the rules. So they changed it for the health system he's in. And then Gilbert flew to Washington, D.C., and we got all the Medicare rules changed so that he could have catheters so that he wouldn't have the urinary tract infections. We had to tell the story of Gilbert, the implications when he got the urinary tract infections, how often he was out of work, and what the cost of the Cipro and the hospitalizations were versus extra catheters. So I learned that in order to make change happen, you have to tell a story, get to people's hearts, then you have to extrapolate. I said to the audience, how many other people in your health system use catheters or in wheelchairs? Nobody knew. Gilbert knew. So we had to extrapolate. Everybody has to know the numbers. Then we have to look at the human cost, how often Gilbert's out of work, and then the financial cost. And when you create that trajectory, it allows you to make the changes you want. So story, extrapolation, human cost, and patient cost. Questions are thoughts about this because I think this is one of the most powerful ways that you, in whatever position you're in, can create change at a local level or a national level. Yeah, I like your comment about the real barrier.
Is this a good time, Maureen, just to pause to answer a
Yeah,
couple of those
please.
questions? Shall I just reflect what's been popped into the chat? So there's a question there around how to have the type of influence you're describing when you don't have formal authority in the system. So maybe you don't have the job title that describes you as a leader, but you want to have that influence.
So that's a great question. And if you asked me this back when I was a staff nurse or a head nurse or a nursing supervisor, I I don't know if I would have had the courage or the self reflection to tell you. But what I have learned in reflection, looking back, is that when you use your voice by as an advocate for a patient and you go through that kind of trajectory, you can start to build the will for change. Like in that audience, when I was telling the story, even if you're not up on a stage somewhere, if you're at a staff meeting or you ask if you can go and talk to the supervisor or something, when you come in with that sense of, I'm telling Gilbert's story, and then I'm going to help. Some people will get it in their heart. Not everybody, though. So then you have to extrapolate, say, it's not just Gilbert. There are this many others. So then you get to people's minds and then their wallets. And I think that's what helps. When I was a young staff nurse, my second job, OR first, second job was ICU. And I would walk every day. We had a new building, and I would walk every day through a 14-bed pediatric unit to the 14-bed ICU. And working in the ICU, every day there were patients in the hallway, there were patients in the emergency room that couldn't be transferred up because the census was always so much higher than the bed capacity. But when I walked every day through the pediatric unit, there'd be a few patients. And so I'd walk through this beautiful, empty, almost empty unit to this overflowing unit. And I was a staff nurse. And so I had been reading about progressive care units. That's how old I am, like step down units and all this new technology. So I went to the head nurse one day and I said to her, why don't we see if we can take over the pediatric unit and make it a progressive unit? And that will help flow for our patients in the ICU. And she just looked at me and said, no. And so I went home and I was distressed about that. And after about a week, I went back to her and I said, would you mind if I talk to the supervisor and ask her this question? And she said, yeah, go ahead. So I went and asked the supervisor and she just said no. And again, I was so distressed. And then I kept going up the ladder because I was feeling like there was a solution here that nobody would listen to. And finally, I ended up in the CEO's office and he started laughing at me and he said, you're asking me to tell the pediatricians that they have to move out of the brand new unit back to the old wing in the hospital? And I said, yeah. And he said, no. And then he said, I'll tell you what, you go to the pediatrician's monthly meeting, and if you can convince them, then you can do it. And so I went to the first meeting. They laughed and threw me out. I kept refining my story from story extrapolation, human financial cost. And after 6 months, they said, okay. And they did. And that progressive care unit made a huge difference and impact. I was a staff nurse. It wasn't like I had any authority. It was just like I had passion about making things better. And I guess resilience in that I could keep going. But
That
is
real
that helpful, Gemma?
tenacity. Yeah, absolutely, absolutely. And it sounds like from your story there, Maureen, it's also thinking about where are the levers that you can influence, and there's not just one, is there? So different people in within the organization that have different sphere of influence and power, and making that case heard by that right one person can be the change that you need.
Yeah, yeah. So it's kind of persistence and
Yes,
guts, I think.
yeah,
Um, yeah, but looking at Gilbert, I couldn't stop until we changed the policy.
yes,
Looking at the empty pediatric unit, I just felt like it was moral,
yes,
um,
yes,
and
exactly.
professional.
Yes, and there is there's a question in the chat there as well around how you keep that motivation and passion when you're working in circumstances where there's low staffing and morale is low, and the kind of environment doesn't really promote that approach. How did you keep that passion alive, Maureen, in those circumstances?
I guess it was because I couldn't sleep, you know. I'd get into bed and I was so bothered by it. I couldn't,
Yes,
every night I'd be trying to fall asleep and I'd be thinking, do I walk away from this? Is there a pathway to try and create a better way? How do I tell the story? And who is the person I should try and convince? But I think as nurses, we see the system in such a different way. And most of the time when you go in to talk to somebody about change, you're you're talking to somebody who's got a very focused lens on something, and it's our job to broaden that. Taking people on walks, I think, is absolutely a powerful way to do that. Having that CEO stand in front of the door, I will never forget his face because he
yeah.
had never seen that before. He walked by it every day. He had never seen that before. So I think taking people on that, telling stories about patients, and then extrapolating. I
Thank
have
you. Thank you, Maureen.
I
There's
I have a
lots of
few.
further conversation, but you carry on and we'll pick those conversations up later in the presentation.
Okay, great. And this is Gilbert. After everybody started to say that he wasn't a patient in a wheelchair, I said to him, "What do you want to do?" And he said, "I want to do rock climbing." Now he's paralyzed from the waist down, and yet that's Gilbert doing rock climbing because he decided that that was going to be his job. And so once I got everybody to think. Um, about what mattered to him and what his dreams were. Everybody came together and nurses came together to help his feet, and there he went. So I think there's so much I think that we can do. A lot of it is the passion and the stories, but a lot of it is tools. And I'm sure that you've taken a look at this work by Tom Nolan, one of my unbelievable mentors, who looked at what are the ways that we can improve, that we can run strategic improvement goals. And you might even like print this off and just take a look at it at your desk every day. Where am I in this? Is it, have I set the goals? How am I going to test it? How am I going to spread it? But I think there's lots of ways for us to use these improvement tools and make the difference. And there's a couple of thoughts. One is building the will for change means that you have to be multilingual, as I said. And then it means harvesting and defining ideas and helping people to see new ideas and asking what matters to you. So I'm going to give you a couple of examples of what matters to you, and then I'm going to come back to harvesting some ideas from other places, other countries, other industries. So many of you might have heard me talk about Jen Rogers. Jen's a nurse in Scotland. I was on my way to Paris to one of the IHI forums in 2012. And on the plane, I was reviewing my plenary talk and I picked up a New England Journal of Medicine article and I saw this article in there about shared decision making. And in the article was this one sentence that said, "You can't only ask what's the matter, you have to ask what matters to you." It was by a physician and a nurse practitioner at Mass General. So I was so moved, I kept reading that sentence. What you can't say only say what's the matter. You have to ask what matters to you. I ripped up my plenary and rewrote it. And in Paris, Jen Rogers was one of the nurse participants in the audience. And I said, when you go back, you have to not only ask what's the matter, you have to ask what matters to you. And about a week later, Jen sent me this most amazing story about a young girl named Kendra, who was the first patient she went to take care of after the forum, and how what an impact it had asking that question to Kendra. It changed Jen, and then Jen started to spread what matters to you around the pediatric hospital in Glasgow and then to the adult hospital. And pretty soon I started getting stories from all over the world. This one was from Norway, Anders Vege, a nurse in Norway. Um, he has everybody wearing what matters to you buttons. But when I was there at Norway next, he brought me to a whiteboard, and most whiteboards, at least here in the US, if they still have them, they have the patient's name, their age, their doctor, and their DNR status. But Anders, after that forum, went back and he changed it so that now the whiteboard is the patient's picture, what they like to be called, what matters to them, and then all the other stuff. So I'm standing here and I say, tell me about this lady. And he said, she's 88 years old and she says, never take me out of my room without my hair done and my makeup on. And I said, tell me about this guy. And it says, he's 82 and he wants two scotches every night at 5 o'clock. And I stood there in front of the whiteboard and I thought, I kind of know these people now. And all the people who um, were on that board, they started to look at each other in a different way. One of them was this elderly guy who was a real pain to take care of. No, every morning everybody would like, you do it. I did it yesterday, you know. And one day, one of the nurses came out after bathing him on night shift, and at change of shift, one of the day nurses said, did anything make you smile last night? And she said, that guy. And everybody said, he made you smile? Why? And she said, when I went in to bathe him, I said, what matters today? What would make today a good day? And the guy said, I want to wear my blue shirt. And she said, why? And he said, that was my wife's favorite shirt. And she died 2 years ago today. And I want to honor her. And the whole time he was being bathed, he said how they met, what their courtship was like, what their marriage was like. And then afterward, he said, can you get me in my wheelchair? I want to go out and tell all the other patients about my wife. He had never left his room before. It like totally changed him, this one question, and really getting to know him. So it's a simple thing, but I think now it's turned into a movement around the world. There are over 50 countries now that meet every month, and we're sharing research and stories. And I would love for you to join. I have the links on the website at the end to share with you so that you can join whenever you like. It's free, it's easy, and people say it's incredibly meaningful. This is from the Royal Free in London. I don't know if any of you are from there, but this is from Karen Turner, who was an occupational therapist there. And she was at that meeting and went back and started asking what matters to patients, but then also said we need to ask what matters to staff and then what matters to the Royal Free. And at first, people were really afraid to ask, but what we're finding now is that the benefits are to patient experience, like getting your blue shirt or having your two scotches at 5. But we're finding incredible joy in work, not only when the provider, the nurses are asking the patients, but also when the leaders are asking the nurses. And so all of a sudden it's changing culture. And we're finding in research around the world that it's increasing joy in work and improving retention and creating new partnerships across the organization that didn't exist before. And at first, people were saying, well, I'm afraid to ask because patients are going to ask for a Lamborghini or something I can't do. So Karen put up a little matrix on the walls of hospitals. Actually, it started in England and then went around the world, but saying when you asked, was it put a sticky note in the quadrant? Was it very easy to do and like the blue shirt or I want warm socks? Or was it a collaboration was required, but it was doable? Um, was it complicated, but I could just make the change with my team at the staff level? Or was it very complicated? And what we found is that most of the time it was doable. It was in the top quadrant. And so people got courage then to ask the question because they realized that they very likely they could do it. And then the research showed that 60 to 70% of the time, the staff actually changed their plan as a result of asking. And 70 to 80% of the time, the staff learned something new about their patient. And 80 to 90% of the time said that it totally is improving the conversation and the connection that they're having with patients and families. So I think it turns out that a simple question can make a huge difference to patient outcomes, to staff satisfaction, and it's really interesting to see the stories that are coming out from this. The other movement that I wanted to talk about is, and many of you probably know Bob Klaber, a pediatrician in London, and Bob was at one of the forums and he heard me, Don Berwick and I were doing a plenary talk. And Bob, the pediatrician, was sitting in the audience, and we were talking about kindness and compassion and empathy. And Bob was sitting there in the audience, and he said, "This is soft and fluffy stuff." This said, and he started to look at his phone, and he said he just was tuning out, and then all of a sudden, something hit him, and he said, maybe kindness is the business end of healthcare. And so he went back and started really thinking in totally new ways about kindness. And now, then Bob and I were doing a plenary a few years later, and it was during the very beginning of COVID. So we had to do the planning just by on phone calls. And then at the end, when we did the plenary and it was on kindness. And at the end of the plenary, again, it was on online. We said, we have had so much fun and learned so much having these planning calls that we're never going to stop. And we're going to have these calls every month. And the next one's tomorrow. And we had 63 people from around the world join the call. And we still have monthly calls on kindness. And again, you're invited to join free, very passionate and incredible. And I've got the link at the end. But this is the kindness in health care now. A whole movement is starting around the world, and especially nurses are finding that it's restoring their sense of humanity and bringing them back to some of the reasons that they joined the profession to begin with. There's this wonderful book by two doctors here in New Jersey, if you haven't read it, called Compassionomics. And they were looking at the scientific evidence and the financial power of caring. Like they did a study where they were looking at anesthesiologists and their connection with patients going into the OR. And when the patient would get wheeled into the operating room, they would, they would be so stressed. And then the anesthesiologist was looking at, okay, what kind of anesthesia am I going to give you to take you out of the pain? He did an experiment where he said the anesthesiologist come out of the OR and meet the patient before they're wheeled in. And the anesthesiologist just has to put his or her hand on the patient's arm and say, my name's Dr. Bisognano or Maureen. I'm going to be your anesthesiologist. I'm going to make sure that you're comfortable all the way through the surgery. I will be with you and I will make sure that your care is easy and will bring you back to the recovery room in about 1 hour. That 30 seconds of interaction made the patient need less anesthesia in the OR, less post-op pain medication, and then shorter lengths of stay. It made a huge difference. And these stories in compassionomics are incredible when we really go back to what brought us all to nursing to begin with and helps us to think about this in a new way. So basic acts of kindness are helping faster wound healing, reduce blood pressure, and shorter hospital stays. It's just incredible. So take a look at this, and I think it will shows the benefits not only of being compassionate with our patients, but the compassion has a really positive impact on us as well. So I think I want to spend a little bit of time on listening because I think listening for alignment is one of the critical leadership skills for nurses. And this is a story about a hospital, a patient, a housekeeper that I met with recently. And he was a housekeeper in a hospital. And I was asking him to tell me about himself. I was asking him questions about his job. And he was telling me about he kept looking like there was something wrong. And I kept asking him questions, and he was telling me about a painful moment that he had had. He said he was called to the Human Resources Department about a month before I met him, and he was told that he was fired. And he said, why? And they said, you're absent too much, you're unreliable, and you're fired. And he went back to clean out his locker. And when he opened up his locker and he started to take his things out, he started to cry. And one of the other housekeepers said, why are you crying? And he said, I've been fired. And she had heard around that hospital people saying, what matters to you? So she said, why were you fired? What matters to you? And he said, I'm going through a terrible divorce. And if I don't go to court, I will lose custody of my 5-year-old son. And he is what matters to me. So the other housekeeper put up some white construction paper on the wall. And she said, um, she put the names of all the housekeepers up there. And she said, what matters most to you? And he said, I have to go to court. And it's on Tuesdays, Thursdays, and Fridays. And then she started to fill in all the blanks. People need to drop off their kid to school at 4 o'clock. Everybody started putting what mattered to them up on the whiteboard, and she created a totally new way of staffing around what mattered. She went to the leaders, and this is the housekeeper, and said, I've looked at this. I've looked at turnover, how much turnover we have and why. I've looked at what matters to everybody. If I can promise you that we can staff the housekeeping department ourselves, and it won't cost you any more money, and we will cover every unit reliably, will you let us do it? And they said, yes. And now this is spread throughout the whole hospital. People are really caring, not only about charting how many days you're absent or how many days you're late, but really what matters to you and how can we as a team come together to ensure our work together. So one of the most important things I can leave you with today is these three things: IQ, EQ, and CQ. And I would say every week you want to make a little, maybe Sunday night, when you're thinking of planning for the week, make a little map about what you're going to do each week on IQ, EQ, and CQ. IQ, you're going to read one of the journal articles that's piled up next to your bed, or here you're joining a collaborative of group of people who are learning together. But there's so much that we've got to learn. And I think keeping a little bit of time every week to work on your IQ is critical. EQ, how are you going to work on your emotional quotient, especially if you're feeling burned out or if your team's feeling burned out? And I think a lot of it's going to be about walking around, talking to patients, talking to the housekeeper, um, just sitting at a patient's bedside or sitting with a patient in an office while they're waiting, um, talking to a staff person about what their week is like. But it's truly reconnecting with the emotional reasons that we came into nursing. And then the third is CQ. Go and listen and learn. And sometimes it's from outside of healthcare. Sometimes it's, I think, something that from inside healthcare. But I think just be constantly looking at curiosity. Um, and I think working on your CQ, like if I'm in a grocery store, I walked into a grocery store once and there was a big sign on the door that said, "You will never have to wait more than one person ahead of you in the checkout line." And I kept staring at that poster saying, how did they do that when crowds vary throughout the day, when people come more on the day before snowstorms? So I ran right to the back of the store and said, I need to see the manager. And I sat with him for an hour and he taught me how he did that. I came back and created a whole new model for waiting. It's just constantly being curious and constantly listening. And I don't know if you've been working on these listening skills, but these listening skills will help you with all three of those lessons. Listening one, listening skill one is when you're just downloading information. You're just hearing things, and it's mostly it's you're reconfirming your old habits and opinions. Listening to is when you start to open your mind and you notice differences, and then you disconfirm some of the old things and bring in some new data. Listening three is empathic listening. That's when you open your heart. And that's seeing through another person's eyes, emotional connection. And then listening four is when you're opening your will and you're connecting with all these new ideas. So the next time you're sitting with a patient or you're one of your team members, just stop and reflect. Where am I in my listening? And there are these essential skills for being human. This was a wonderful article by David Brooks in the New York Times, and the study shows that only 30% of people in the world are good question askers. And there are all these social skills that I think are incredible um, assets for leadership. You know, if your mind closes, then you're not going to open up any new possibilities for ideas. So working on this is really just take a look at this. It's really thinking about how can I understand where this person is coming from. Um, one story recently was a nurse she called me from another state in the United States, and she said that she was taking care of this elderly patient who was dying of cancer. He has very bad metastatic cancer. The doctor figured he had maybe about a week or maybe two to live. And the nurse was in taking care of him. She bathed him, she got him all set. And she said, "Is there anything else I can do for you right now?" And he said, "There's only one thing I want." And she said, "What?" And he said, "I want a grilled cheese sandwich." And she said, "No, you're NPO. You can't have anything by mouth, and I'm sorry." And then she walked out of the room. And then she stopped outside the room and said, "What am I doing? The guy's got like a week left to live." So she and the doctor talked about the risks and the rewards of a grilled cheese sandwich. And she went back in with the grilled cheese sandwich. He cried, she cried. And then he had a grilled cheese sandwich for the next 5 days. And he said that that mattered more to him than almost anything else in his life, is that she listened to him and that he could, at the end of his life, have the one thing that meant that much to him. And we're always talking about microaggressions, but you can build micro affirmations. You can build in new ways to be seen, when someone's talking, your body language, if you're like this and you're looking, oh yeah, just finished, or you're on your phone or all those things, people read that in a different way. Respectful silence, eye contact, just the way that you're looking at people makes all the difference. And so you might practice it again. Practice it when you're stressed. Practice it to say, my normal reaction would be, oh, Jesus, and yet you can practice new ways to do microaffirmation. And then lastly, I just want to hit on a new one new way to think about co-production and co-design. Um, Before I do though, Gemma, are there any questions in the chat or anybody want to make a comment?
Yes, we have had some more questions, Maureen. Thank you so much. And the stories that you're sharing are just illuminating the points that I think we're seeing in people's reflections in the chat. But one of the questions from Wendy was around how we might be able to frame our influence in a way that it can't be ignored as just moaning or always identifying the problems but not ever really being able to see any change happen as a result. Do you have any advice for Wendy?
Oh, I think it's a great question, Wendy. Um, Again, it's why I was doing that part about listening, because if you feel like nobody's listening to you, your reaction used to be or could be negative. You roll your eyes, you fold your arms, and that shuts off everything. That shuts off any possibility of change. I think it's when you're thinking about this, it's really how do I reflect on my listening skills so that I'm keeping the lines open. It was that CEO when I said to him, "You've got to come for the door." I could have yelled, I could have walked off, I could have written a negative feedback, but taking him by the hand and standing in front of the door allowed us both to see the same thing. It's a great question.
That's really, yeah, absolutely. I can see that it's about framing, it's about
Yeah.
relationships ultimately, isn't
And
it?
your reaction. Yeah.
Yes, yeah, absolutely. And any thoughts around how we might be able to improve that disconnect between the sort of frontline perspective, those that are living the day-to-day challenges, and those in leadership positions higher up the hierarchy? I guess there's a bit of a tone through the chat that's saying there's a real distance between the two and not necessarily opportunity for mutual respect.
Yeah. Well, let me tell you a story, and I think it reflects another example of this. Is there anybody from Sweden on the call?
Oh, I'm not sure. Nobody said so, but
Okay.
perhaps they might say hello now you've said.
Well, this is a story that I think is very powerful on how a frontline nurse can make not only a difference with a patient, but a whole hospital and a whole country. Um, So I was in Sweden and I said, and this is something I would recommend that you do is whenever I go to a different hospital or clinic or any place, I always say, take me to the place you're proudest of. Because I would never know to ask to go to these places, but they know. So I was in Sweden in Jönköping and I said, can you take me to the place you're proudest of? And they brought me to a patient self-dialysis unit. Now, I know patients do their own hemodialysis and peritoneal dialysis, but this was different. And I met this guy, Christian, and um, I said, tell me about it. So this guy, Christian, he was a mechanic at Saab Avionics. So he was a mechanic at an airline company. Um, and he came down with glomerulonephritis and ended up on dialysis. And after a couple of weeks of going to the dialysis, he one day said to the nurse, he said, I can do this myself. I'm a mechanic. And so she knows nurses can, I mean, patients can do it themselves. So she said, okay. So she taught him how to do it himself. And then the 73-year-old lady in the next um, dialysis bay said, hey, I can do that myself too. And so then the nurse said, okay, maybe I'm thinking about this differently. Maybe I was thinking about my job as providing care instead of teaching patients how to take care of themselves. So the nurse then said, okay, let's try it differently. And maybe we can look at patients who want to do their own dialysis and who can, and have them do it themselves. And it was pretty amazing to go to that dialysis unit because if you look on the bottom picture there, the dialysis unit looks like this. Everybody's exercising. They are the most healthy people I have ever seen. So while they're dialyzing or before they do, they come in and they eat healthy food and they exercise together. So it's social connection, it's independence, and it's caring for yourself. So I asked Christian, I said, how is it going for you? And he said, I have a new definition of health. It's not like my lab work is okay. He said, I'm living a full life. I have energy. I'm teaching other patients. And I said, what about safety? And he said, well, of course the care is safer in my hands. It's all my bacteria, and you all have different bacteria. And I always do it the same way. You all do it differently. So he said, of course it's safer in my hands. And so then here they all are exercising and very healthy. It didn't matter how old they were, they became healthier every single day. And so the an update now is it's 50% of the cost, complications dramatically reduced. And I said to Christian, what matters to you? And he said, there's only one thing. Well, one, I want to go back to work. And two, he said, I want to get married. And I did get invited to his wedding. Um, but when I asked the nurses how they were measuring their success, they said they measured their success by the number of patients working. And I thought that was just so empowering. You know, if I've gone to hospitals all around the world, outpatient clinics, and to see nurses saying, my measure of success is the number of patients working was incredible to me. And that now I started to tell that story and to the nurse Britt Marie and the patient Christian. I was telling that story, and a nephrologist from Texas brought them over, the nurse and the patient, to totally redesign his dialysis unit. He'd been doing it the same way forever. And when Christian walked in, he walked up to one of the young patients that looked like him, and he started to turn the dialysis machine around. And the local nurse said, "No, no, you can't do that." And he said, "Why?" And she said, "He might touch." He said, "That's the whole idea." So that nurse, Britt Marie, and Christian, the patient, transformed that dialysis center in Texas. And now that nephrologist has spread it all over the United States. And it's just incredible to see the impact that a nurse and a patient frontline could have when they start running plan, do, cycle, acts,
Yeah.
check cycles, and then measuring clinical impact, measuring patient satisfaction, measuring work satisfaction, and measuring cost. And to see Britt Marie, now Britt Marie has been speaking all over the world, and she's a staff nurse in a nephrology unit who's made a bigger difference in kidney care than perhaps anybody else I know. And asking Christian, what matters most to you? I want to get married. I got invited to the wedding. I said, what matters most now? He said, I want to have babies, and this is his
Oh,
little baby. And so now he's got kids. I said to him, did you go back to work at Saab Avionics? And he said, no, I'm an RN. He went to nursing school, and he's the head nurse at an ENT unit now.
oh,
But just that nurse, Britt Marie, changed everything in his life, his kids' life, dialysis around the country. And now I love this, that there's a new little app called What Matters to You for dialysis patients. So when patients are diagnosed as needing dialysis now, they get this little card to pick out, and it said, does it matter to you if you have dialysis at night or during the day? Do you want to do it at home, or do you want to do it at the hospital? Do you want to travel? You know, all these things that matter to you. And then that helps the clinicians co-produce the design for how the dialysis will happen. So our kindness now work is, as I said, been going on, and we're starting to see amazing results coming out of this. People at first were focused up, you know, like on um, kind behaviors are as effective as any action in creating psychological safety, growing base of impact on kindness and outcomes. We're also finding a lot of people are challenging unkind behaviors, which they never did before. They used to just turn around and walk away and grumble or quit or move to a different unit. But now in the kindness work, they're learning how to challenge unkind behaviors in a way that is producing really positive results. It's giving the person who's experiencing the behavior courage and tools, and it's really helping people to see that you acting that way is producing an impact that's way beyond what you're thinking. And then this is how we might work differently. So this is the kindness in healthcare. Um, link. If you just send a link to Bob Claver on the kindness in healthcare, he'll sign you up for the monthly calls. And here are the links to whatmatterstoyou.world and kindnessinhealthcare.world. And I'll stop sharing and see if we have got any questions or comments. And you'll have all the slides, so.
Thank you. Thank you so much, Maureen. And I think possibly you've enacted exactly what you've been trying to advocate for today in showing the power of storytelling in those individual cases then that can extrapolate out to local systems, national and then even international change, which is so inspiring to see. And we did have a comment from Rita saying that she herself learned from your Joy at Work movement and campaign and has implemented similar in her own hospital, which is wonderful, isn't it, to get that feedback. Would you mind telling us more about the Joy at Work programme as well, Maureen?
Yeah, so this was started in part from the kindness movement and in part at IHI, looking at the a lot of the improvements and the innovations we were trying to do. They were held back by the discontent of nurses and physicians around the world. So we figured if we really wanted to make innovation happen, if we wanted to make improvement happen, we really needed to focus on the staff. And so we created a model. If you go onto ihi.org, there's a model called Joy in Work, and you can take a look at how asking these questions and what activities you can take. You can take them if you're a nurse leader, but you can also, if you are seeing pain among your peers, your colleagues, or yourself. And I ask people at the end of each week, after you do your IQ, EQ, and CQ, you should stop and ask one patient what matters to you. Just try. This whole movement started by people having the courage to ask one patient, and then that gave them ideas, courage, inspiration. Ask one family member because you will find so many different things from family members. But for the patient, you might get a grilled cheese sandwich. For a family member, you might find that the visiting hours or the locked door. Ask one of your own family members what matters to you. I found very interesting conversations when people start to ask what matters to you around dinner at Sunday night. And it kind of helps people plan for the week in a different way. And then ask what matters to you. I think it's really important. I always say you can't give what you don't have. And so you've got to make sure that you're taking care of yourself as well.
Absolutely. Yeah, asking that question to yourself is so important, isn't it? And possibly something that we neglect. I was thinking as you've been sharing as well, Maureen, there's something about the collective approach that you've described. So individuals have started these movements and shown the impact, but it's the bringing together of communities of like-minded people that have enabled that ripple effect and the momentum to gather it. And it made me think that it's really important that our Nursing Now Challenge community members join these different communities so they
Yeah.
don't feel isolated and don't feel like they're individually trying to change the system. We're around others that feel as passionately as we do.
It's so much fun.
Yeah,
To hear the stories and not everybody's on the call as a nurse, but most, I would say.
yeah,
And just to hear the stories and the impact, it like opens your heart for the
Yes,
month. And both the kindness one and Bob Klaber is just an incredible uh, person to bring people in from all over the world. We have people who get up in the middle of the night in Australia and New Zealand, British Columbia on the other side, and all over the world because it's really making a difference to culture.
yes, absolutely. And is there one final takeaway message, Maureen, that you'd like to give to our community on what we've talked about today?
I would say just try it. It might seem like you might have none of these people, these people examples like Christian or the people who are making all these global changes, they didn't have the end result in mind. They had the question.
Yes,
They had the question, and they said, could I try this? And it's that plan, do, study, cycle, act. It's constant learning, and it's learning how to communicate and listen so that you're building the will for change.
excellent. Thank you so, so much, Maureen. We have valued your time and your insights, your personal experiences, the stories you've shared from the wonderful people that you've met. Been incredibly inspirational as always. So thank you very much. Thank you everyone for joining us, for the questions and the reflections that you have. I hope that you're going away feeling that bit of additional energy, and also that where that passion lies within you, that you'll really see that tenacity that's needed to keep going with it. Thank you so much again, Maureen. Take good
Oh,
care.
thank you all. Thank you all. I
Thank
feel
you.
like I'm turning over the reins to the next generation, and
Absolutely.
I'm encouraged and inspired by you all.
Wonderful. Thank you again. Take care, everyone.
Thanks.
Bye bye.